The member from Kenora-Rainy River.
Thank you, Speaker. To the Minister of Infrastructure, the Mary Berglund Community Health Centre in Ignace is one of the top healthcare facilities in the north, with people from across the region travelling to the CHC to access its services. In 2010, through the Ontario Realty Corporation, this government more than doubled its rent, putting their long-term viability at risk. After much pressure, the Northwest LHIN agreed to provide the Mary Berglund CHC with a temporary and partial funding increase to 2015, after which time the CHC will be forced to further cut staff and services or close its doors. My question is simple. Is the Ministry of Infrastructure so short on cash that it has to pillage other departments to pay its bills?
Thank you. Let's be clear here, Mr. Speaker. The Mary Berglund Community Health Centre is paying $5 a square foot rent. I would hardly describe that as an onerous level of rent. I don't know if anyone in this House knows of an organization that pays $5 per square foot rent. Outside there, it's 30 or 40, and in most small towns in Peterborough you pay a lot more. As a matter of fact, what we can determine is that the going rate for rent right now is $12 a square foot. So by any measure, Mary Berglund has a very good deal. We have been working right now because the policy of the government, so that we don't artificially subsidize through the back door, is to have a market rent, which would in this case normally be $10 or $12. But there is a default position for some centres which has been in place for about 15 years, which is to go to a standard 5% $5 a square foot rent. We're working on other solutions, but right now I don't think the challenge is the rent they're paying.
Thank you. Supplementary.
Minister, this situation is not acceptable. Your department is working with facts and figures that are way out of line with a community of Ignace's size and northern location. Other comparable CHCs in the north that occupy similar spaces pay $60,000 rent, while Mary Berglund CHC is forced to pay $200,000 a year. Something is not right. They do not have 40,000 square feet. They have 1,700. They are not paying $5 a square foot, let me tell you. Minister, I urge you to fix this problem by either lowering the rent to a more reasonable amount or selling the building to the CHC for a nominal amount. We need action now to avoid another healthcare crisis in Northwestern Ontario. Minister, what are you willing to do to ensure that your department fixes this situation?
Thank you.
That being said, Mr. Speaker, I do agree with the member's point. She's absolutely right. We have to reconcile to get a rent, and from what I understand, and I am working with you on this, and we're on the same page on it, the volume of space that I understand Mary Berglund has is part of the problem. They're in a building that has a lot of challenges with it, and that. So what can we do about this? Well, the local LHIN, Infrastructure Ontario, is working with the Health Ministry to try and reconcile the rent and the payment system right now, because they can't afford it. We're also looking at the amount of room, which I am told, and I will be going up there as soon as the House rises personally to visit the site, and I would be happy to tour it with you, to try and look at if we could reduce the amount or find other ways to reduce the amount of space so that the storage or surplus space they don't need, they don't have to pay for. So we're very committed to working with you on a solution, but the point that the rent is very high, until someone shows me other evidence, it looks like it's about half what the going rate is.
The member from Kenora-Rainy River on a point of order.
Mr. Speaker, I would like to correct my record. In my supplementary, I mistakenly said that the Mary Berglund CHC occupies 1,700 square feet. It actually should be 7,200, which makes their rent at about $27.70 a square foot.